Welcome to Marian Ayurveda. In this episode, we are going to discuss a condition called scoliosis. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. I believe that most people are at least somewhat familiar with the condition known as scoliosis. If our spine curves forward like this, it is called kyphosis, and if it curves excessively backward, it is called lordosis. But if the spine curves to the side in an S shape, it is referred to as scoliosis. Modern medical science does not have a clear understanding of the causes of this condition. According to modern medicine, if the curvature of the spine exceeds 45 degrees, surgery is recommended. In this episode, we are considering whether it is possible to correct this spinal curvature without surgery. Or is it possible for us to prevent a spine with a 30-degree curvature from worsening, or even reduce it from 30 degrees to 20 degrees? I would also like to talk about the various types of Ayurvedic treatments available for this. First of all, regarding the cause of this, why does a person develop a curved spine? I am going to share the two reasons that I have understood and observed in my practice, the two reasons that I personally feel are responsible. One, some children have absolutely no appetite. It is during adolescence that the spine grows the most. These children don't want breakfast in the morning, they skip lunch as well, and if they eat anything at all, it's just in name only. Because of this, during adolescence, when the spine or height is increasing the most, these children are not getting the necessary nutrition for their spine, or their muscles are not getting the nutrition they need. So when the weight of the head and the body comes, or when the school bag adds weight, I feel that the spine bends to the side where the weight is greater. That is, it curves towards whichever side is carrying more weight. So the first reason I feel is that the body is not able to absorb enough nutrients. This happens in two ways in today's times. One, in quite a few people I have treated, acidity has been a significant issue. That is a serious gas problem. Whatever they eat doesn't get digested. That's the kind of problem they're talking about. And if we look at the eating habits of such people, either they drink excessive amounts of tea or coffee, or they eat things like pickles, achar, papad, or they consume spicy foods, or they drink a lot of soft drinks. Among those who do these things and have significant acidity or gastritis problems, what happens is that the food they eat does not get digested. So if there are 5 people in a household eating the same food, those with this much acidity or those who have gastritis are not able to absorb calcium or other minerals necessary for the bones from the food they eat. That is why their bones do not develop proper density. One reason I feel is that the spine is not getting enough strength. The second reason is that for some people, due to the use of various medications or for other reasons, their liver is not functioning properly. We know that the liver is one of the major organs in the body. If it does not function properly, the body will not receive adequate nourishment. Those essential nutrients will not reach us, and the strength of the bones and so on will decrease. So there are two main internal reasons that I have noticed for this. One is acid gastritis or issues in the digestive system related to the liver or intestines. If these are not addressed, no matter what kind of surgery or treatment we do, unless these two problems are resolved, the person's spine will never gain enough strength. That's what I have understood. So the first step I take in Ayurvedic treatment is to correct their digestive system. Usually what everyone says is that after taking the medicine, they feel a good appetite and are able to eat well. As soon as they start eating properly, the spine receives adequate nourishment. Now, the second thing I want to mention is that when they come for treatment, what I have often observed in these individuals is that their muscles have severe issues. The muscles on one side are extremely hard, while on the other side, the muscles are very loose. So these hardened muscles are pulling the spine to one side. This is actually a factor that leads to more curvature. So by loosening a muscle that is tight, or sometimes these muscles are bunched up like a knot, we can normalize these muscles through the correct therapy. We need to tighten the muscles that are loose. Only then will these muscles be able to pull the curved part of the spine and straighten it. With a muscle that remains loose, the child will never be able to improve. So the second point is to tighten the muscle that is loose. The third point is to strengthen the spine. When we talk about the spine, we know that there are many muscles around the spine. There are tendons, ligaments, and also discs. Treatments that strengthen all these parts. We know that the oils in our Ayurveda have a lot of power. By applying a mild warm oil stream starting from the head, from the cervical area, from the bone, all the way down to the lumbar region. If we give a gentle spinal massage and an oil stream like this, usually for about 7 to 14 days, that's what we need. By doing just this, the spine, ligaments, and all the muscles become stronger. This helps everything return to normalcy. So from a therapeutic perspective, when we looked at some of the cases we treated, there were cases with more than 45 degrees of curvature. After this, following such treatments, we have been able to see that the curvature reduced to about 15 degrees, becoming much less. So at that point, we were able to move away from the level of surgery from that parameter and were saved from it. When the curvature, which was at 45 degrees, reduced by 15 degrees, it came down to around 30 degrees. Similarly, we have come across many cases with a curvature of around 30 degrees. So in those cases, it is not progressing further, and we have also been able to reduce it as well. I always say, in Ayurveda, the maximum time we need for treatment of something like scoliosis is about 10 to 14 days. We can definitely give it a try. Now, whatever the result may be, we are able to correct so many things there. We correct the child's digestive system. Similarly, we correct the muscles. We strengthen the spine. These are the three main types of treatments we do in Ayurveda. The reason I mentioned earlier about paying attention to the diet is definitely because of the problems that occur in the stomach. So the basic thing is to avoid consuming spices that cause a lot of acidity or gastritis, and also to avoid tea, coffee, soft drinks, or foods that are spicy as much as possible. Never skip your morning breakfast. If we pay attention to these things, we can find a good solution for this scoliosis without it leading to a major problem. Let's meet again in another episode. Thank you.